Evidence is in. South Africa's sugar tax is working. Since the government implemented the health promotion levy in 2018, people are buying 28% fewer sugary drinks. The tax on sugary drinks was an attempt by government to address the country's raging diabetes epidemic and the high rates of obesity that fuel it. For more on this, author Adele Sulcas joins us. Adele, thank you very much for your time this afternoon. You're going to have to excuse me if I play devil's advocate for just a little while. Every decade, the health industry seems to pick the biggest culprit, fat, oil. This time round, it's a big toss-up between meat and sugar. We know countries with a high poverty index, quality of nutrition is low. So when we look at diabetes and obesity, we look at carbohydrates, fats and sugar, not just sugar. Do we have enough evidence that sugar tax works to pursue this and double that tax?
We have enough evidence from studies around the world. There are about 50 plus countries or cities that have introduced a sugar tax. And many of them introduced this longer ago than South Africa did. So ours was introduced in 2018. There are some that were introduced 10 or 15 years ago, and they've all shown varying degrees of success. So yes is the answer. They are effective, but all the researchers in the field will tell you that a sugar tax alone is not going to be enough to address obesity, diabetes, hypertension, other non-communicable disease epidemics. There are other things that need to be put in place.
So one of the counter-arguments, especially from members of the beverage sector and the Sugarcane Growers Association, is job losses. What are we looking at in terms of weighing up those two? Because we have to look at people's health, but we also have to look at unemployment. That's a big factor in South Africa.
Yeah, that is true. To be honest, I don't have the figures in front of me around the job losses in the sugar industry related to this. Some jobs, I understand, have been repurposed. I think what the scientists involved in the sector would say is that, of course, job losses and economic issues are a major concern for us in South Africa, but that is a relatively short-term view of the problem, because we are dealing possibly with tens of thousands of jobs and lives and possibly hundreds of thousands of families who are affected now. But if the sugar industry can be slowly converted into an industry that produces sugar-based products for other uses, like ethanol, for example, for fuel, that could go a long way to redressing the economic impact of losses of sugar beverage jobs, and would do a lot to improve the health of millions of South Africans.
What are we looking at in terms of alternate regulations for the beverage industry specifically, in terms of reducing the amount of sugar in their drinks instead of taxing consumers?
Well, the way the health promotion levy works actually taxes the producer. And this speaks directly to your question, because what has happened is that the health promotion levy taxes every gram of sugar above 4 grams per 100 mils of sugary beverage. So this has had the effect of incentivizing producers to lower the total grams of sugar in their drinks so that they will have to pay less tax. They do, however, pass on the increase in their costs to consumers. And so this has had the dual effect of reducing consumer purchases because of higher prices, and it's had the effect of formulators of drinks and producers of drinks reducing the amount of sugar in the drinks, so that there's a kind of double impact in a positive sense.
So sin tax has been proved to be effective on a number of levels, but ultimately educating consumers, that's the prize. That's what we want. We want people to make healthy choices for themselves based on information they have. Where are we as a country in terms of working towards healthy, affordable food across the spectrum, and educating South Africans about healthy choices, especially where nutrition is concerned?
I think that researchers and experts in the field would support me in saying that we have a very long way to go. Our policies around food and nutrition and healthy eating are way behind where they should be. And one of the things that has been emphasized actually by the group at WITS who have done this recent evaluation is that the sugar tax is only a beginning. Yes, it needs to be strengthened. Yes, sugar taxes work. That's been proven all over the world. But it is one small piece in quite a complex set of measures that need to be put in place, like, for example, introducing very clear, very easy to read front of pack labeling on all foods so that consumers can identify what is healthy and what is unhealthy. And importantly, to ban direct marketing of unhealthy foods to children. This is something that has been introduced in the UK and has been proven very effective already. And those two additional measures would be an enormous strengthening of our country's efforts to ensure that we start eating more healthily as a population.
Well, thank you very much for your insights. That was author Adele Sulcas. Time now